What do you do when your doctor doesn't believe you're in pain? On a scale of 0 to 10, with 0 being no pain at all and 10 being the worst pain imaginable, how is your pain? Because pain is impossible to diagnose objectively, doctors often refer to a chart of emoticons to understand how their patient is feeling. At the bottom of the chart is the frowniest of frowny faces, pure, unadulterated agony. At the top is a carefree and happy smiley face, no pain at all. It's called the pain scale, and it is tragically flawed. I would know. I suffer from endometriosis, so I am well acquainted with all the various ways doctors try to get you to measure suffering. This self-reporting tool is otherwise known as the numeric rating scale, which dates back to the origins of the opioid epidemic, when OxyContin was first approved in the mid-1990s and the American Pain Society developed the pain as the fifth vital sign initiative. Because the pain scale failed to improve pain outcomes and helped drive the opioid epidemic, a movement has been born in the U.S. to abandon the scale altogether. But it is just that, a movement, not policy. The pain scale is still widely used across medicine. The pain scale becomes a tug of war, a battle of who suffers most convincingly. The less commonly used visual analog scale is an older pain rating tool. It's mostly used to measure pain associated with chronic conditions such as endometriosis. It consists of a straight horizontal line, both ends are capped with a short vertical line to mark the extremes of pain. Then the patient is instructed to mark an X to approximate how much they are suffering. Whichever scale a doctor uses, the use of a scale at all brings up an important question. How does your doctor know what your 10 feels like? If I had to describe my period pain to someone who didn't have endometriosis, I'd say that the heights of my pain felt like a dull knife being dragged across the lowest part of my abdomen, sawing back and forth to slice me open. Sometimes, sitting down on the toilet felt like a dagger being twisted inside my colon, cutting into my perineum. When that happened, the blood would drain from my face, my forehead growing damp with cold sweat, bile rising in my esophagus. I would gasp, trying not to vomit or faint, digging my fingernails into my thighs. And then, after the moment passed, I usually just went back to work. Trying to explain any of this to a person who doesn't know it firsthand feels useless. Has a doctor or partner ever really experienced a pain like having their testicles pushed into their rectum, then stapled into their intestines, not just once but several times a month, every month, for most of their lives? Has your BFF ever been stabbed directly in the butthole with a serrated bread knife? Has a teacher or employer ever missed a day because their vaginas were full of red-hot shrapnel? All this isn't good news for sufferers of endometriosis, an incurable disease that many people rate as worse than unmedicated labor. At least, Lara Wellman would certainly say so. In an interview, she described how one period landed her in the ER. "I had my period and I wasn't feeling well. The best way I could describe it is, it was like a Charlie horse in my uterus that lasted, like, half an hour. I've had 3 babies. I've had a tooth infection. I've had pain, right? And I was just brought to tears by it," says Wellman, who is a white 45-year-old cis woman. In generally, women make up the majority of chronic pain patients due to a confluence of factors. 1. That women are more sensitive to pain. 2. That women are more susceptible than men to painful diseases. And 3. That women are more likely to go to the doctor, which transforms them from chronic pain sufferers into chronic pain patients.